Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Good evening, and I'm so excited to be here with you. And we have a great guest. Dr. Zeno has volunteered his time. We're going to talk a lot about diabetes and high blood pressure and how you can be healthier. So we want to invite you to give us a call. Let me give our numbers. 855-644-3278, and our operators are standing by waiting to hear from you. If you would like to text us, you can text us. That's a great way to get your question answered. Our text is number 423-834-7307. And we're so glad you tuned into Heart of Health Live. And remember, on our program, we're here to serve you. We want to help make your life better. We want to talk about the things that interest you. So give us a call. We'd love to hear from you. We also want to invite you to go to our website. That's heartwiseministries.org. And on that site, we have a prayer section where we pray for your needs, because we believe that God is involved in the healing process, and He wants us to be healthy, and part of that is having a relationship with Him. So we want to do the prayer team. If you happen to be traveling, we want you to help us. You can write a review of a healthy restaurant you just went to. We just got a review not recently from someone in Austin, Texas, about a healthy restaurant in Austin. So if you're in that area, you might want to check out that restaurant, because we fully believe if people have good food choices, they will eat better. And there's been so much in the news about modern medicine going on, all the new pills and procedures out there. We're here to help you navigate that as well. So if you're channel surfing tonight, we want you to stop right here in Heart of Health Live. After break, I'm going to introduce you to Dr. Zeno. We're going to find out a little bit about him and how he got interested in helping others and serving other people. Don't forget, you can join us on Facebook. Be one of our Facebook friends. Keep up with what our ministry is doing. So stay with us after break. I'm going to introduce you to Dr. Zeno. And yes, you're watching the Heart of Health Live.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At Heartwise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At Heartwise, we believe in truth, love, and healing.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our phone callers are waiting for your calls. Our number again is 855-644-3278. And Dr. Zeno, welcome to the Heart of Health Live.
Thank you very much. I'm glad to be here.
Now, what got you interested in becoming a physician? How did it all start in your life?
Well, it all started because my dad actually wanted me to be a doctor.
Okay.
And I wasn't too interested in that. I wanted to be a mad scientist.
Okay.
I love physics and mathematics and so on, so I didn't think that medicine would be the kind of thing for me. Until I was in college. I was studying engineering, and I wanted to take some courses in physiology and so on, and it was really difficult to do that. But once I got involved in physiology, it made the whole thing worth it.
Right.
And so I did that and some of the social sciences and so on, and I decided that
now,
medicine was
where
for
were
me.
you born?
I was born in Trinidad.
Trinidad,
Yes.
okay. We have people that watch on Trinidad, so if you're in Trinidad today, give us a call.
Yeah, when I was 12 years old, my family migrated to North America, and I went to school in Canada at McGill University. That's where I did my undergraduate training.
Right.
Yeah.
And you see patients and you take care of people. I know you've told me you travel the world giving lectures and talking to people.
Yes, we've been all over.
Well, you're going to get a chance to hopefully to talk to some of our callers soon about diabetes and hypertension, and we'd answer other questions. But diabetes and hypertension is a pretty big problem, isn't it?
It is. As a matter of fact, and it's a growing problem, both of these. And the same way we talk about hypertension or high blood pressure as being the silent killer, many people have pre-diabetes and diabetes, and they don't even know that they have it. Because one of the more common symptoms of people with pre-diabetes and diabetes is actually no symptoms at all. They might feel a bit more fatigued, but who doesn't feel tired?
Right.
Right? So they think that this is just natural tiredness, when in fact it's part of a growing symptom complex that later on they'll realize they have an entire metabolic derangement.
Now, some people out there might not even know they have diabetes. How might a person feel? You said fatigue, but what are some other symptoms they might have if they are diabetic?
If they have diabetes, then and the blood sugar is pretty high, let's say above 180, 200, what they will end up with is going to the bathroom very frequently. Okay. And if that is happening, then they'll also have a lot of thirst. So they may think that they're drinking a lot of fluid, and that's causing them to go to the bathroom, when in fact what might be happening is that they're going to the bathroom, that's causing them to be more thirsty, they're drinking more, and that combination is something. They may also feel more hungry than usual and be eating more. Okay. But then today there are a lot of grazers, so people tend to eat a little bit here, eat a little bit there, so they may not notice that they're actually increasing the amount of food that they're taking in.
Now we throw around the term diabetes, but there might be some people out there that don't even know what diabetes means. But we talk a lot about diabetes. Well, what is diabetes?
Okay, well, there are different kinds of diabetes, and there's the diabetes that occurs in pregnant women, and we call that gestational diabetes. And every woman who is pregnant really needs to have her blood sugar checked. Typically when she finds out that she's with child, and then in the third trimester, the last part of pregnancy, her doctor or practitioner will recommend, and she should go ahead and have her blood sugar checked. So that's how we find out about it. Now, it can be prevented if someone has had gestational diabetes before, or they're prone to developing gestational diabetes. The same way this can be worked with is the same way that type 2 diabetes, which is what I'll discuss in a little bit, can be prevented.
Okay. So gestational high blood sugar. So mainly diabetes is high blood sugar.
High blood sugar, right? But now, along with that high blood sugar, are other things that are going on. There's high cholesterol,
Okay.
right? There's high triglycerides. And these individuals, if they don't have if they don't change the metabolic soup on the inside,
Okay.
right, then what they will end up doing is having a lot of complications of this metabolic derangement.
Yeah, so
See?
I guess a better word for that, instead of calling this diabetes, you could just call it metabolic derangements.
Exactly. It's a bunch of metabolic derangements that we can characterize by the blood sugar being higher than normal.
Now, most people in the States and around the world have what type of diabetes, would you say?
Most people have type 2 diabetes.
Okay.
This kind of diabetes is more or less reversible. And I say more or less reversible because depending on what stage you might be in, it may be more or less reversible. But the vast majority of people who have type 2 diabetes probably don't need to have it at all.
Wow, and we're going to talk about that because it's a big problem because more and more people get diabetes every year.
That's correct.
Okay, so,
And then, of course, there's type 1 diabetes, which is an autoimmune disease.
Right.
Basically, the person's body fights against the production of insulin, which is a hormone that is necessary for the glucose or the sugar in the blood to get into the muscles and the other cells of the body so it can be used for energy. And if we are fighting against the insulin itself, then we don't have that insulin around to be able to negotiate this movement of the sugar from the bloodstream into the cells. So the blood has an accumulation of this of the sugar, and the person's sugar goes higher, their blood sugar goes higher, and then they end up with full-blown diabetes type 1.
so Dr. Zeno, if someone doesn't feel well and they think they might have diabetes, how would that be diagnosed?
Okay, there are two basic ways that we do this in modern times. One is to do some blood tests while the person is fasting, and the other would be to do some blood tests either fasting or after they have eaten. First with the fasting. If somebody is they haven't eaten for the last 12 hours, we can do a simple blood sugar test, and if that blood sugar is 126 or greater, then we say it's likely that you have diabetes. You have to repeat the test, and if it comes out the same or higher, then we say you have diabetes. Okay? Now, that's for the diagnosis of diabetes. We also can diagnose diabetes looking at another test, which is the hemoglobin A1C, which is a test that's looking at kind of the average of your blood sugar over the last 3 to 4 months.
Okay.
And so, the doctor would have that test ordered, and if that value is abnormal, then it also means that the person has diabetes. Now, the other way of doing it is to look at what's happening before and after eating. Okay. That one is actually more sensitive. In other words, you can diagnose diabetes a lot earlier if you use the before and after blood sugar test. Okay, so the person hasn't eaten for 12 hours, we take the blood sugar, and then we check the blood sugar at the time that they take some sugar load, right? Sickly sweet kind of glucose load. They take that in, we do that at that time, 30 minutes, 1 hour, 2 hours, 3 hours, 4 hours, 5 hours afterwards. And the one that we're most interested in is the 2 hour after eating. If that one, 2 hours after eating, is above 140, we say that this person they have an impaired glucose tolerance.
Okay.
Something is not working right, or it's a pre-diabetes. If it's over 200, then we say the person frankly has diabetes.
So you're designed when you eat food to get that blood sugar from the blood into the cells pretty quickly.
Exactly. And what happens is the body anticipates what's going to happen, right?
Yeah.
And as we start eating and the blood sugar starts going up, our bodies produce a burst of insulin. And that's the first phase of insulin release, and that helps to control things all the while you're eating. But when that first burst goes, the body also starts producing a new amount of insulin, and that's secreted into the bloodstream as well. So that by the time you're finished eating, what goes on afterwards to get that the effect of the food into your blood, then that insulin works.
Well, we're going to go to a break right now, and our phone lines are open, 855-644-3278. We're talking about diabetes and hypertension on the Heart of Health Live with Dr. Zeno.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
In case you're just joining us, we're talking about diabetes and high blood pressure and any other problem you might want to throw our way. We're here with Dr. Zeno. He's been around the world helping people do better. And you give us a call at 855-644-3278. And before the break, we were talking about diabetes, and we sort of want to focus on type 2 since so many people have that.
Exactly.
And you gave a good definition of the blood sugar above 140. After the glucose tolerance test, of course, the hemoglobin A1C, you gave us the symptoms. And it sounds like the blood sugar might not be the problem, it's just the result of the problem.
Exactly, because what we're dealing with is that the metabolism is not working the way it should. And the metabolism is just all of those reactions that we have in the body.
Now, I'm going to stop you right there because if we can let everyone know why this is happening, the real cause, maybe we can get some people off some medicines and avoid this diagnosis altogether.
Yes, we can.
So let's talk about what could be the cause of this blood sugar being so high.
Well, the blood sugar itself needs to get into the cells so that the cells can have the energy to work.
Right.
And if there's anything that impedes that blood sugar getting into the cells, then this will cause a problem because it'll back up into the blood. Right. One of the things that does this is when the insulin isn't doing the job that it should do. And so we call that kind of process insulin resistance. So some people develop this insulin resistance, and that's associated with really the way we live and the accumulation of fat in the body.
So type 2 diabetes, you have enough insulin.
Yes. Usually you have sometimes more than enough.
It just can't do its job.
Exactly.
And you're saying that part of the reason is maybe because of the way we live that hurts the insulin.
Exactly.
Well, what are some things that might hurt the insulin doing its job?
Well, one is the accumulation of fat. Now, but all fat is not created equal, right? Someone with fat cheeks, the fat on the cheeks is not causing the problem. The fat around the waist is the one that's causing the problem.
Okay.
The fat down, if you look at maybe how some ladies have fat distribution that's in the lower portion of the body, that is usually not the one that's metabolically active, but the one around the waist, the spare tire, you know, that little extra baggage that we can carry there. That one is the one that's doing it. And then we go a little bit further and say it's not only the one that you can see around the waist, but actually the amount of fat that is around the internal organs.
Okay.
Okay. That what we call visceral fat, because some people may look pretty slender on the outside, but they've accumulated a lot of fat on the inside.
Right.
And it's only if you operate or you do an imaging study that you can actually see the amount of fat that might be in there. So that's an issue. The other one is really, and of course, the accumulation of fat. Some of it is genetic, but most of it is about how we live, and we can talk about that.
Yeah.
The other issue is, of course, physical activity.
Okay.
You know, the way our muscles are, and the way God made us, is that if we are physically active, we don't really depend on just insulin to get that sugar into the cells, because we have some transport mechanism that bypasses the insulin. So when we tell someone who is at risk for developing diabetes, or someone who has diabetes, that they need to become physically active and exercise, it's as if we're giving them the prescription for a shot of insulin.
Right.
Because it is as effective, for the most part, as insulin would be. It just bypasses the production.
Well, I heard someone once say that 1 hour of physical activity was worth 5 units of insulin.
This is
I don't know if that's right.
Oh, this is a number that we use in general.
Yeah.
Because in places like Wildwood and other lifestyle centers, what we have found is as we work with people and we help them to improve their lifestyle by eating better, by being physically active, within a matter of days, their blood sugars start coming down.
Unbelievable.
And the amount of medications that they use get taken off. And the insulin, for most people who are using insulin with type 2 diabetes, the amount of insulin that they use comes down pretty rapidly.
So it looks like you're telling our audience that if we can get fat out of the diet, fat out of our bodies, and exercise, there's a great chance we're going to fix this problem.
Yes, there's a very great chance that we're going to fix this problem. And the earlier we do it, the better. If you're to look at the realm of reversing the problem, the further along you are, the less likely it is that it'll be reversed. But to be far along, it really takes some time to do this. You're looking at about 20 years to get to the point where we'd say, you know, really, I don't think that there's much that we can do to reverse the process. And now what we have to do is to treat the symptoms and treat the problem. And most of those people end up having to be on insulin.
Well, I'm going to hold you there because we've had a question that's come into our website that relates to this. And it says, doctors, I've had type 2 diabetes for 2 years. My blood sugar is always high. I'm on a medication called metformin. Is there any way I might be able to get off this medication? What would be your suggestions? Now, we can't give specifics, but we can talk in general.
In general.
Someone's on a medication, they come to you and say, I really want to get it off, Dr. Zeno. Where would you start with it?
Okay.
We've had it for 2 years.
The first thing that we would do is we'd meet the person or talk to them and find out what their lifestyle is like. Okay. If the person happens to be someone who is not physically active, if the person happens to be over fat, not just overweight, over fat, and if that fat is distributed around the midline, etc. These things will let us know what the profile of the individual is. Now, someone saying that I've only had
2 years,
diabetes for 2 years, that's good and not so good, because I'll explain it this way. Many people who have diabetes and high blood sugars, they don't know that they have it. So they may get to know that they have it for 2 years.
So they might have had it many years.
They've been having it for 10 years.
I see.
Okay. As a matter of fact, in one study in Minnesota, what they found was on average, people didn't find out that they had diabetes until 6 years of the process being, evolving. Right. So 2 years, let's add 6 to that. So we're looking at somebody who's probably been in this situation for about 8 years.
Yeah, okay.
Right. Now, if that is the case, then we'd have to look and see how much insulin effect does this person have. If they have a lot of insulin effect, okay, then the process is almost 100% reversible, because it means that once we get the fat and the exercise and the dietary things taken care of, right, the insulin that they have on board will be able to work and it will do its job.
Wow. So you just do that with lab work?
We do that with lab work. We do that with the interview.
Right.
We examine the person, because there's some people who are more prone to having insulin resistance, whether or not they have an increased weight. They have, some people may have some dark pigmentation in the folds of the neck, under the arm,
right,
etc. We call this acanthosis nigricans. People with this tend to have a higher incidence of insulin resistance, and then whether or not the person is overweight, we'll have to go after the insulin resistance.
So it sounds like in treating type 2 diabetes that the relationship that you have with your patient is very, very important.
Very important. Actually, with anybody with any illness. Sometimes people say that doctors, or today we say practitioners, right, are specialists in treating disease. I take offense to that. We should be specialists in treating people.
Right.
Right. Some people may have a disease, and some people may just have risk of a disease. And what we're supposed to be helping them with is to not get that disease, as opposed to just waiting until they have the disease to treat it.
And I found out that most people are willing to make steps one at a time if you're in a relationship with them.
Exactly.
And unfortunately, our society, give them a pill, a bill, next. I don't have time to teach you or follow up with you. Yeah. Well, this is a great discussion. Calls are coming in now. We have some more questions on the website. Our phone number, 855-644-3278. Check our website out, heartwiseministries.org, or check us out on Facebook. Dr. Zeno will be back with your questions after this.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Before break, we were answering a question about a person that had had diabetes for, they thought, 2 years. And I thought it was very interesting that they probably had it for much, much longer.
Yes, yes.
And just by doing some lifestyle changes, and it was possible that they can come off the medications. Now, there's so much medications on. You know, you see metformin, Byetta, one after another medications. And I've yet to figure out the real place for diabetic medications. What's your opinion on that?
Well, you know, some people like the idea of a quick fix.
Yeah.
So what they think is, I will take the medication, it will get my blood sugar down, and I will be home free. But it never is that way.
Because we talked about the problem is not getting the blood sugar from one place to another, it's what causes the blood sugar. Right.
And most people don't have diabetes because they have a medicine deficiency.
Okay, that's good.
That's not the problem.
Right.
The problem is actually usually how they live and what they're doing or not doing that's actually promoting this. And if they change what they've been doing to be doing something that is more in line with a healthy life, then they will reap the benefits of doing that.
So medications don't cure type 2 diabetes?
There is no medication cure for type 2 diabetes.
Wow.
No.
But getting what we talked about can potentially cure that type 2?
Exactly. It can actually reverse the process so that the person does not have diabetes anymore. So I don't like to tell people, and I don't like to call people diabetic.
Right.
Okay, because it means that if you say that they're diabetic, then they're identified with the disease, right? Because the process is reversible, someone may have had diabetes, reverse the process, and now they're completely free of diabetes. Would you call that person still a diabetic?
No.
I wouldn't at all, right? So for many people, there is a lot of hope that this is a reversible process. Now, notice I'm not saying that there's a guarantee, because it's not 100% of individuals you will catch early enough. So it's very, very important that if someone has a family history of diabetes, if they're overweight and they're gaining some weight, especially around the midsection, they're in their 40s or 50s, or even if they're younger, but they're gaining a lot of weight, these are issues that are involved. Even if someone was, when they were born, they were underweight or 9 pounds or greater, they have an increased risk of developing diabetes in their 40s.
Wow. You know what I've been so concerned about is people that they start on diabetic medicines right away. They say it makes them hungrier, and they end up eating more.
And they eat more.
So they take more sugar in, so they never get at the core of the problem. So they just sort of, the snowball keeps getting bigger and bigger and bigger.
Exactly.
And then they take more and more, and eventually that medicine doesn't work, and they go on insulin, and it just seems like it's just a big problem.
You know, one of the things that actually pushed me, I'm an internist and geriatrician, and one of the things that actually pushed me into becoming a diabetologist was actually when I was working in Reading, Pennsylvania, seeing patients who had diabetes and who could have, I mean, the whole process could have been prevented, but then they were all the way down to having amputations and blindness and being on dialysis. I just could not live with myself to say, how can I let people do this and treat them after the fact when I could help them to prevent this, and they don't have to live this this life of misery.
Well, you know, long term, these metabolic derangements change the entire body.
Exactly.
You know, you see the eyes and the heart disease is just tremendous. That's one of the first questions I ask is, are you a diabetic?
Right.
Because my suspicion goes up so much that their symptoms are coming from an acute heart problem. Are you diabetic? Do you smoke? So I'm just glad you're giving us all some hope that there is some things that they can do. Now, I know you work at Wildwood. You guys have a website there that people can learn more if they need to get some help on this?
www.wildwoodhealth.org.
www.wildwoodhealth.org. And they can, if someone's interested in learning more, they can come visit you and learn more from your website.
Or they can write to me.
Yeah, that's good.
DRZENO, that's Dr. Zeno.
Dr. Zeno.
At wildwoodhealth.org.
Now, a lot of people are learning things even online. You know, they live far away, they can still learn this, and they can take courses and have people help them to have better health. Because many physicians, you know, practitioners aren't trained in this.
That's correct.
You know, they aren't trained in this. They don't, you know, they don't do this. I don't think not that they don't want to, but maybe they just don't have the skills to do it.
And, you know, most of us are so busy in our lives and in our practice and whatnot that we might think, you know, to have to learn to do this one, might be might be even easier to just give the person the pill.
Yeah.
Right? Doctors aren't ignorant.
No.
And they know that some people, all they want is really the quick fix.
Right.
So why spend all this time helping the person with this, that, or the other when they're not going to do it? But in reality, many people, and more than one might think, is actually willing to make the kinds of changes, one step at a time, if they have the information and they have the power to make that change.
Now, Dr. Zeno, what do you really do to motivate someone, to really get them into it so they feel empowered to make that change? It's not hard. It's hard if you've eaten a certain way or live in a certain culture. How do you get them inspired?
Well, besides what I do, sometimes the disease itself is part of the inspiration.
Okay.
You see, someone who looks down the line and they see the suffering that is coming their way, they get motivated because they want to avoid those problems. Unfortunately, it means that for some of them, they have to have a problem first, and then they see it, right? But for others, giving them good information, having them look and see what happens to other people, that makes a difference. And then for those who are spiritually inclined and looking at the world through those eyes, they realize that to take care of your body is something that is a precious thing to do, right? It's something that's a spiritually motivating thing to do. And we have strength to help us to do that.
Yeah, so I guess to motivate people today, even if you don't feel bad, at least get your blood sugar, fasting blood sugar, to see if you might be in the early stages of having a metabolic problem.
Right.
Well, that's so interesting. Now, are there some people that cannot reverse type 2 diabetes?
Yes.
Okay.
These individuals are those who have burnt out, essentially, their pancreatic cells.
Had to work so hard, right?
Yes. They had to work, so-called, they had to work so hard. It's more complex than that, but that's an easy way to say it.
Okay.
Their pancreas is tired. It is not producing enough insulin. The insulin, therefore, cannot work because they don't have enough of it, and therefore, they will need to have something to help them.
Now, how can you tell if this is the case?
We can measure insulin levels.
Okay.
Most insurances don't pay for the insulin levels in the United States, but it's something that can be done and should be done for someone who has diabetes, and maybe your insurance would pick up the cost.
Yeah, that's very interesting. So, and every year, unfortunately, they come up with more and more medications and more different ones. And I remember years and years, there was one on the market, and then they took it off the market because it caused bad things to happen. I think that was Resolin. I don't know if you remember that one. But that wasn't on very long. So, and all of these, and I've seen, fortunately, metformin. I see lots of patients on that, and I saw one had a bad metabolic acidosis a couple weeks ago from that medicine. So every medicine has its risks. That's a risk. So I think it'd be better to change your chemistry by eating smarter and exercising a little than doing this. Now,
and even getting enough rest and sleep.
Yeah.
Now, many people don't realize that that if you sleep less than 6 hours a night, you increase your risk of having type 2 diabetes 200%.
200%?
200%.
Wow.
Right?
Well, that sort of makes sense to me because any type of stressor on the body, it makes adrenaline.
Exactly.
And adrenaline's going to raise blood sugar. And if you already can't get the blood sugar into the cell, where's it going to stay?
Exactly.
So that
and then if this is a chronic thing, then they have other hormones involved. Cortisol gets involved. And then we have some others that people probably wouldn't have heard about, the ghrelin and leptin and whatnot. All of these things stimulate to cause the person.
So you're going to part of it, exercising, resting more, all those good things. Wow, these are interesting questions. We have a question about high blood pressure after the break. So stay with us. You're watching the Heart of Health Live. We're here with Dr. Zeno, who works at Wildwood. He's already given you a website. We're going to be right back.
The Heart of Health Live will return in just a moment.
Meet Charlie. He's a normal guy with a big problem. You see, Charlie doesn't like to eat healthy foods, and now he's overweight and doesn't know what to do about it. Luckily for Charlie, he's found Weight Management by the Book. Weight Management by the Book is a complete weight loss solution that includes 7 DVDs with 5 hours of lectures, a workbook with over 100 healthy recipes, and an exercise band so you can exercise at home. Dr. Charlene McCullough is a nutritionist, author, and speaker, and together she and Dr. James Marcum talk about the practical ways you can manage your weight and do it the way God intended. As it turned out, it was the best decision Charlie could make because he was able to lose weight and feel great. So now that big problem Charlie had is no problem at all and has completely gone away. Don't you want to know how to manage your weight God's way? For a donation of any amount, we'll send you the complete Weight Management by the Book set of DVDs, workbook, and exercise band. But hey, don't take our word for it. Here's what others have to say about our program.
Weight Management by the Book was an answer from God.
I love that this program focuses on relationships as well as diet and exercise.
Thank you for giving me the hope to change and for doing it in a loving way.
So what are you waiting for? Visit our website at heartwiseministries.org or call our telephone number 855-644-3278.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Okay, we're glad you joined as Dr. Zeno is telling us how to help with type 2 diabetes. We have a lot of questions. Let's go to those, Dr. Zeno. This one comes from your home country of Trinidad.
Really?
From Linda. So we're glad Linda's talked to us, wrote us in. It says, I awake at 4 to 5 a.m., very early. Have breakfast at 8, so she's up for 3 or 4 hours. And she asks, is it important to eat at a specific time within awaking to regulate blood sugars? You know, you have that served in the morning, yeah. What's your advice?
My advice would be, if she's having problems with control of her blood sugar, then, Linda, if you're watching, then you would want to take a look at changing your breakfast time and see if that makes a difference for you. Everybody's not the same. Mm-hmm. However, we have a peak in a particular hormone called cortisol around 8 o'clock in the morning. And when that goes up, that causes more blood sugar to be released from the liver. So if you're eating at the same time that is going on, then you may actually be promoting even more blood sugar into your system. And if you're not optimizing your lifestyle, in other words, you're not exercising appropriately, you're not getting enough rest at night, etc., these things might interfere. So while I would say it's good to have a regular schedule of eating and a regular interval between awakening and having your first meal, which should be the largest meal that you have, I would say that some of the other things around it would make a difference as to whether for you would need to stick to a very specific regimen of 8 o'clock in the morning or 7:30 as your general rule. You know what I use for my general rule is when I'm hungry, God gives me the sign to eat when I'm hungry. Now I don't have type 2 diabetes, but God gives us hunger for a reason. So anyway, thank you for the call, Linda. This is a text one, and this is when I eat starches like rice or potatoes, it's like taking a sleeping pill. Within 1/2 hour, I'm sleeping, then I wake 1 to 2 hours later. So big carb load, goes to sleep. Is this diabetes? The short answer is it may be. Mm-hmm. So my recommendation to this viewer is to go ahead and get the blood sugar checked. And for that person, I would do the entire 5-hour glucose tolerance test, the 5-hour oral glucose tolerance test. Talk to your doctor or your practitioner and request that particular test. Yeah, and that could pick up what her blood sugar is doing. Maybe that's making her. Here's Cynthia, and I think this is one we've already talked about already. She's writing from Florida. She says, I'm a type 2 diabetic, and what's the best thing I can do to reverse it? I think we sort of talked about that a little bit. Yes. First, I wish there were just an easy answer to say, for you, this is what you need to do, right? It depends on who you are. It depends on how far along you are. But changing your diet to, and we haven't really talked about what the elements of the diet, but going to a plant-based, low glycemic index diet where you get rid of most of the saturated fat from the diet, and having an adequate amount of good proteins like from beans. By the way, beans have been shown to be as helpful to people in terms of control of their blood sugar as some of the medications that they use, right?
Yeah, it does.
So, you know, when we tell people to have beans for breakfast, they think that's a strange thing to do, but actually it's very helpful for people with diabetes and also for anybody. There's no such thing as a diabetic diet, really. There's a good diet, and if we were to follow that kind of a regimen, it will do better. The other thing is, of course, having adequate amount of physical activity. A mixture of aerobic and some resistance exercises would be helpful for that individual.
Sleep too.
Adequate sleep. Yeah. That is 6 to 8 hours of sleep a night. Going more than 9 hours of sleep a night, I didn't tell you this one, that one increases your risk 300-fold, 300%.
Okay.
So really, the best is about 7 to 8 hours of sleep a night, and that's optimal.
Here's one that asks about cinnamon. Is cinnamon a treatment for type 2 diabetes?
Okay, so the research with cinnamon has shown very clearly that in many people with type 2 diabetes, it helps to regulate the blood sugar. Okay. So if someone has blood sugar that's not well controlled with the way that they're living, etc., then they might want to add cinnamon to the diet, or they might add it to the diet anyway as a general blood sugar control factor.
Okay. Now we've got another person that's concerned about eating too much fruit. Is eating too much fruit, has lots more, carbs in it. Is that a concern for type 2 diabetes?
It can be a concern for some people, especially if the kind of fruit that they like happens to be, they're not going to like to hear this one, the tropical fruits. Okay. All right? Because the tropical fruits have a higher glycemic index. Okay. Now, it doesn't mean that you don't eat the fruit. Right. What it means is that the amount that you eat would be less. So yes, fruit may be involved in that. I also tell people that dried fruits, okay, if you're going to be eating dried fruits, you can't eat the same quantity of dried fruits as you would eat. Because
it's concentrated.
Because it's more concentrated, right? Additionally, if you're going to process the fruit and make some juice or some puree or something like that, the more processed the fruit is, actually, the worse it is with regard to your blood sugar control, and the higher your blood sugar will go. So I tell, the fruit, the whole fruit, nothing but the fruit. That works out very well.
That's a good one.
And using the temperate fruit as opposed to, going overboard with the tropical fruit.
Okay, good. Michelle writes from California. She says, have you heard of a natural medicine called Tecfidera? I haven't heard that. Was told I should take it forever. What is your advice? Well,
I don't know.
I've not heard of that, but I would be very suspicious, Michelle, of anyone that told you had to take a medicine forever. I would just be very, and if you go to a website, heartwiseministries.org, and spell that out for me, I'd be happy to do a little bit of research for you on this. Okay, this one's from Dorothy, and she asked, what are some general principles to help me get off blood pressure medicines? Now, we haven't talked much about blood pressure, but what are some things that people can do to help lower their blood pressure from a lifestyle perspective?
Okay. Again, as with diabetes, it depends on who the individual is. Because there are some people who have high blood pressure, and it's because of a specific illness that they have. Right. And treating the illness actually gets rid of the high blood pressure. So that's something that people have to think about. It's not very common. We're looking at 5 to 10% of individuals who have this secondary high blood pressure, but we have to mention that. Okay, we have to look for that. Okay. The next issue then is this person overweight? Do they drink alcohol? Do they have a high-fat diet? Are they physically active? Do they get enough rest, etc.? Any of these things that might be deranged, then you just do what needs to be done to optimize that.
So it sounds like the same recommendations for diabetes apply to high blood pressure.
Very similar recommendations. There are some other things, though, such as the amount of sodium in the diet. Even though everybody isn't sensitive to salt, about 1/3 of people who have high blood pressure actually are responsive to lowering the amount of salt in their diet. So that's something she might be in that 1/3. Then there are some people who have not enough calcium in the diet. So if the person doesn't have enough calcium, then having more calcium in their diet, and they can get the adequate amount of calcium by having more broccoli in the meals. They don't have to necessarily go after the dairy or anything like that to get the calcium.
You know, I like kale and spinach.
Okay, and that has ample amounts of calcium.
And what I've been doing, I've been eating it raw lately because one of my friends that works in this field says, you know, digestion starts in your mouth, and when you start eating it, then you get some of those good nitrates in you, and it helps nitric oxide go up, which makes your arteries bigger, which can help a lot of things.
A lot of things. So yes, eating those green leafy vegetables. Very helpful.
Well, this makes sense, Dr. Zeno, because these are things that changes the chemistry of the entire body and just not one small chemical pathway. Wow, this is good stuff. We're talking with Dr. Zeno about diabetes and blood pressure. We'll be right back. Stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At Heartwise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At Heartwise, we believe in truth, love, and healing.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We are so thankful, Dr. Zeno, that you've given your time.
Oh, it's my pleasure.
And, you know, we're not paying you anything, and we just thank you so much because I know how valuable time is, and just for helping people. And on Heart of Health, we just give information. We try to love people and not judge people, and meet them where they are, and take them to health one step at a time. And we try to, you know, also let them know that there's a God that wants to help them. Now, if people want to get a hold of you, I've got a couple ways. Dr. Zeno, Z-E-N-O, at wildwoodhealth.org. And they have a phone number there.
There's a dot between the doctor and Zeno.
Okay, Dr.Zeno at wildwoodhealth.org. And the phone number there is 706-820-4644. 1493, or if you didn't quite get that, you can go to our website, heartwiseministries.org, and we'd be happy to give that. Dr. Zeno and his team can help you understand, especially type 2 diabetes more. We don't have much time, so we're going to go through these pretty quick here. We have a question. What about diabetes and caffeine? Any problem in caffeine and diabetics?
There are some big epidemiologic studies that have shown that people who use caffeine actually have a lower risk of developing diabetes, but there is no evidence that says that you should have caffeine in order to lower your blood sugar.
Okay, well that's good. Here's a good question, and this one we might have to have them call you later or go to the Wildwood. This one presents diabetes, lupus, fibromyalgia, rheumatoid arthritis, and osteoarthritis. A lot of different problems here. Could these be related, and what can she do to gain back her health?
It seems as though this person is actually suffering from quite a disease burden, and
Yeah.
I'm sorry. And it looks as though many of these might be autoimmune diseases, which means that your body might actually be fighting against itself. I sympathize with you, and send me a note. Let's see what we might be able to do to help you.
Yeah, and that's dr.zeno@wildwoodhealth.org. And sometimes these aren't simple answers.
That's right.
But it starts with a relationship and, getting some people that can help you, encourage you, and help you out a lot. Here's another question. It says, my blood pressure is fluctuating from low to high. What can she do? Now, this is another question, without having all the information, it's very hard.
Right.
But one of the things I tell my patients is make sure you're well hydrated.
Exactly.
That's one thing. Make sure you're well hydrated and look for all these other little variables that can cause it. Any other thoughts?
Well, if it's high when the person is lying down or sitting down, and then it gets low when they stand up, that has a specific set of causes. And your doctor really should know about this, rather than trying to prescribe over the airwaves. That's something your doctor needs to know, because that's orthostatic hypotension, and that can be related to very specific illnesses.
And a lot of people get blood pressure under stressful situations that go up temporarily and then come back down, and that's not as big of a problem. Right. So I'm hoping that that's what you have, and it's not one of these others. Well, Dr. Zeno, we are all out of time, and I just want to thank you so much for joining us, and hopefully we'll have you come back again. And if you have questions for Dr. Zeno, go to our website, heartwiseministries.org, leave those questions, and we'll make sure we invite him back again and answer questions. As you can see, he's got a wealth of knowledge of type 2 diabetes. We didn't even hardly touch hypertension. We can't cover everything in one night. But we want to thank you for joining us, and we hope you learned something tonight that will make your life a little bit better. And if nothing else, we want to let you know that it's in that relationship with your Creator, the ultimate physician, where we're going to find ultimate healing. So stay close to God. Thank you for joining us. I'm Dr. James Marcum with Dr. Zeno, encouraging you to have a healthy, happy life. And remember, at the heart of health is that relationship you have with your Savior. Thanks for joining us.